Health forms the cornerstone of a fulfilling life. Since 2012, the year the Communist Party of China convened its 18th National Congress, the Chinese government has consistently prioritized public health in the national development, implementing the Healthy China initiative as a key national policy. Through continuous healthcare system reforms, China has made significant progress in addressing critical challenges such as high medical costs and accessibility issues, ensuring all residents can access quality medical services. According to China's National Health Commission, a key healthcare reform goal in 2024 was to create a streamlined system linking policy coordination, data sharing, and oversight across healthcare services, insurance, and pharmaceuticals. Central to this effort was building unified digital platforms to support practical features like mutual recognition of lab tests between hospitals, one-stop payment systems, standardized electronic health records, telemedicine, and easier access to care across regions. China's healthcare reforms are addressing a long-standing patient concern: the need to repeat medical tests when visiting different hospitals. The 2024 initiative was to establish nationwide mutual recognition of test results through a carefully phased implementation. By the end of 2025, all integrated healthcare networks must achieve full internal recognition among their member institutions, while municipal healthcare systems standardize the recognition of over 200 common tests. The system expands progressively, with provincial-level recognition covering more than 300 tests by the end of 2027, and major regions implementing cross-boundary sharing, culminating in complete national standardization by 2030. These changes bring immediate benefits to patients, eliminating redundant tests and related costs. Digital platforms now provide instant access to prior medical results, replacing outdated paper records with secure cloud-based systems that offer superior image quality. To address potential quality disparities, especially in grassroots clinics, the reforms enforce strict standardization protocols, conduct regular audits, and implement targeted training programs. This due focus on accessibility and quality control incentivizes system-wide improvement while easing overcrowding in urban hospitals. Technological infrastructure forms the backbone of this transformation. Secure regional databases and a medical imaging cloud facilitate seamless information sharing while safeguarding patient privacy. More than just operational efficiency, these reforms represent a fundamental reorientation toward patient-centered care. By breaking down institutional barriers and raising quality standards nationwide, China is building a healthcare system where patients move effortlessly between facilities, resources are optimally allocated, and public trust grows alongside system capabilities. The result promises to be a more equitable, efficient healthcare environment for all. The direct billing system streamlines medical payments by enabling healthcare providers and social insurance agencies to settle costs in real time, eliminating the need for patients to pay out-of-pocket upfront and file reimbursement claims afterwards. This mechanism simplifies access to basic medical coverage while reducing financial strain on insured individuals. China's healthcare reimbursement system has historically relied on a pay-after-service model, where hospitals faced 60-day reimbursement delays following patient discharges. At Hefei First People's Hospital, this meant shouldering 50 million yuan monthly in upfront payments for insured care. The new real-time billing protocol has shifted to immediate settlement upon discharge, dramatically easing working capital strain for medical institutions. Patients with private health insurance often face a tedious claims process, submitting stacks of medical bills to insurers after hospital discharge, enduring weeks of paperwork while covering upfront costs. To address this, China's healthcare authorities now enable real-time public and commercial insurance payouts at discharge. In Shandong's hospitals, platforms like Yantai's blockchain-driven system automatically process both basic insurance coverage and supplemental plans like resident health insurance during checkout, eliminating upfront payments and weeks of claims filing. Mr. Liu, a low-income resident from Chengdu, Sichuan province, recently experienced a healthcare breakthrough. After being treated for alcohol-related mental health issues at Ziyang Fourth People's Hospital, located 80 kilometers southeast of Chengdu, his 18,000 yuan, approximately $2,500 medical bill underwent an innovative one-stop reimbursement system. Through coordinated provincial policies, his basic medical insurance and critical illness coverage automatically deducted 9,000 yuan, while a government assistance program for vulnerable groups covered nearly all remaining costs. He paid only 600 yuan, approximately $83 at discharge, without filing a single form. This marks a stark contrast to the past. Before April 2024, patients like Liu traveling between Chengdu and nearby cities, such as Ziyang, common in this densely populated province of 84 million people, had to pay full costs upfront, shuttle between hospitals and insurance offices in multiple cities, and wait months for aid approvals. For seniors living away from their home province, whether retirees or those who have moved to live with a family, the direct medical billing system has been a game changer, making cross-regional healthcare as easy as visiting a local clinic. No more complicated reimbursement procedures, just seamless care wherever they are. Living in Hangzhou, a bustling metropolis in eastern China's Zhejiang province, Xiao Li relied on his parents to help care for his young child. His mother and father had made the long journey from their hometown of Hami, a city in China's far northwest Xinjiang Uyghur Autonomous Region, over 3,200 kilometers away from Hangzhou. While grateful for their support, Xiaoli constantly worried about his mother's rheumatoid arthritis treatment. In the past, every doctor's visit came with logistical headaches. Because Hami and Hangzhou belong to different provincial healthcare systems, his mother had to carefully save every medical receipt, waiting until their annual trip back to Xinjiang to file for reimbursement. A months-long process that often meant paying upfront for her chronic condition. Everything changed when China expanded its cross-regional direct settlement system for chronic illnesses. Now, when Xiaoli's mother visits a Hangzhou hospital, her medical treatment costs are settled instantly through the National Healthcare Network. No more stacks of paperwork, no more waiting months for reimbursements. Xiaoli explains with relief. The system just works. It recognizes my mother's Hami insurance and applies the proper coverage automatically. This policy shift has brought profound peace of mind to millions of Chinese families like Xiaoli's. His mother is no longer worried about medical expenses, and Xiaoli can focus on his work, knowing his parents are properly covered, despite living so far from their hometown. The decision, adopted at the third plenary session of the 20th CPC Central Committee in July 2024, a major policy-setting meeting outlining China's social reforms, has prioritized reshaping the country's healthcare system. At its heart lies a directive to expand and redistribute high-quality medical resources to underserved regions, accelerate a tiered care system, build integrated hospital networks, and strengthen grassroots health services. The reform's cornerstone is a tiered health care system, a model designed to direct patients to appropriate care institutions based on medical needs. Historically, China's hospitals faced structural imbalances. Overcrowded urban mega-hospitals with hours-long waits, and underused rural clinics lacking resources. To address this disparity, the policy introduces integrated medical consortiums, collaborative networks linking top-tier urban hospitals with smaller rural and county-level facilities through shared staff, technology, and treatment protocols. The reform also tackles a delicate balance, meeting the public's demand for reliable care close to home while ensuring hospitals at all levels remain financially viable. Urban hospitals now earn incentives for training rural counterparts, while rural clinics receive funding boosts for keeping preventable cases out of overcrowded cities. By redefining how, where, and by whom care is delivered, this reform seeks to turn a fragmented system into a cohesive one, a critical step in China's broader effort to bridge regional disparities. Huashan Hospital, a leading medical institution based in Shanghai, has launched its 5G smart clinic at the 4th Division Hospital in Yining, Xinjiang, and therefore has extended its premium medical expertise from the country's eastern coast to the remote northwest. On the wall of consultation room 503 at the 4th Division Hospital, beneath the side-by-side logos of the two hospitals, reads the slogan, Huashan's Care to the West, a digital bridge. On another wall, the most striking feature is the two high-definition displays. These screens, paired with a professional-grade video and audio system, created the clinic's virtual consultation space, where Huashan Hospital's specialists held cloud-based sessions. In one such remote clinic, Professor Zhu Ming from Huashan's dermatology department examined and provided treatment for 10 pre-booked patients over 2 hours. She diagnosed a range of skin conditions and provided personalized treatment plans. Utilizing 5G technology that enabled real-time communication with minimal delay, she collaborated with local doctors to examine patients. After the session, Professor Zhu highly praised the smooth communication and effectiveness of the remote diagnosis process. The communication was perfectly smooth, comparable to face-to-face consultation, she noted. The first patients of the 5G smart clinic gave highly positive feedbacks. For those in Xinjiang, this means they no longer have to travel thousands of kilometers for specialized care, as top-tier medical services from Shanghai are now available right in their hometown. To enhance care in remote areas, Huashan Hospital will expand its 5G-powered clinics to specialties like neurosurgery, neurology, and infectious diseases, leveraging this technology to bridge regional healthcare gaps. Many people complained about the high costs of healthcare, partly due to inflated prices for certain drugs and medical supplies. Take cardiac stents as an example. In the early 2000s, multinational companies like Medtronic and Johnson & Johnson held a substantial share of China's cardiac intervention market. Imported stents were often priced between 20,000 and 40,000 yuan per unit, a financial burden for patients in need of such implants. That's why the government introduced centralized bulk procurement for medicines and high-value medical consumables to squeeze out these excess costs and genuinely reduce the financial burdens on patients. On July 31st, 2019, China's State Council released the reform plan for regulating high-value medical consumables. This initiative takes a dual approach, removing barriers while strengthening oversight through coordinated efforts across healthcare delivery, insurance, and pharmaceutical systems. Its goals are clear: comprehensively rein in the prices of high-value medical consumables, standardize medical practices, control cost inflation, and safeguard public health interests. Since the program was rolled out, selected drugs and supplies have seen significant price drops. giving people real cost savings. Before the reform, the expense involved in acquiring multiple stents could be prohibitively high. In November 2020, with cardiac stents included in a national centralized procurement program for high-value medical supplies, the price of selected stents promptly fell to around 700 to 800 yuan each, a drop of over 95%. At Shuangfeng County People's Hospital in Hunan's Lodi City, 54-year-old He Weidong now receives quarterly cardiac checkups, a far cry from January 2022, when his acute heart attack required emergency stent surgery. Previously, the hospital lacked both the specialized equipment and sustainable funding to maintain an inventory of cardiac stents. This due limitation forced critically ill patients to undertake risky transfers, traveling 50 kilometers to Lodi or 150 kilometers to provincial capital Changsha for treatment. Before 2021, explains Dr. Wang Gang, the hospital's executive vice president, we had no choice but to transfer heart attack patients. That 150 kilometers travel window critically endangered lives. The turnaround came in August 2021, when the hospital launched its interventional cardiology center. National bulk procurement slashed stent prices to $110, Wang notes. This allowed us to offer 24/7 emergency services. Survival rates soared because now, when minutes matter, we operate within minutes, not hours from help. Some initially questioned, can lower prices guarantee quality? The results speak for themselves. Under the drug regulators' stringent full-cycle oversight, with zero tolerance for quality issues in procurement, selected products, cardiac stents have maintained excellent safety records. This proves it's possible to cut costs without cutting corners, earning trust from hospitals and patients alike. The bulk procurement system delivers savings by leveraging volume, but its biggest impact lies in squeezing out excess, not from manufacturing, but from bloated distribution channels. These carefully structured negotiations demonstrate remarkable effectiveness and promise. By pooling national purchasing power, the program creates bargaining leverage that far exceeds what individual patients or hospitals could achieve independently. This enables the elimination of massive price markups, dramatically improving affordability and delivering real, tangible benefits to the public. This transformative healthcare reform has a profound impact. The centralized procurement mechanism has helped streamline market operations and improve pricing transparency across the system. The benefits are evident in multiple dimensions. Slashed procurement costs for public hospitals, eased financial burdens for patients, and accelerated integration of medical services, insurance, and pharmaceuticals. Ultimately, it's a change embraced by the public for delivering tangible benefits. As President Xi Jinping put it, reform would lose its meaning and sustainability if it fails to deliver tangible benefits to the people. If it doesn't create a fairer society, or worse, exacerbates inequalities, healthcare reform will continue to uphold the people-centered development philosophy, to enhance medical security coverage, safeguard people's health and well-being, and ensure every individual benefits from the reform.